in medical school, really before medical school, I realized that I wanted to be a doctor because I wanted to serve people in greatest need. The driver for me to do that from the very beginning was my faith, just the feeling that, this was who the God I follow cares for and loves, and that he calls me to care for the least of these. Sometimes I stitch up a wound, or sometimes I give an antibiotic and the person gets better. It feels good when you fix a problem like that, but most of the people that I see in my practice have more chronic illnesses, and in that case, I'm walking with them to try to get to a place of better health. But it's not a fixing. It's being a knowledgeable healing presence in their lives. My name is Katy White, and I'm a family practice physician, and I work in a community clinic called Los Angeles Christian Health Centers. It's a federally qualified health center in the heart of Los Angeles. There are a number of hospitals all around Los Angeles, but when one of our county hospitals shut down a few years ago, that left a sort of a black box in south central Los Angeles where there's one hospital serving something like 800,000 people. And that's worse than many third world countries. The reason that hospitals don't go into South Central is because it's not safe and they're not going to make money. That's what it has become. And as long as it's like that, the poor are going to be forgotten. And so who's going to remember the poor? For me, the notion of getting access, maybe it's not the exact same care, but some basic medical care with the Affordable Care Act will help a lot of patients in Los Angeles. Now, Los Angeles has over 2 million uninsured people. Some of those patients still wouldn't be seen under the Affordable Care Act. And I'm not saying that I think we as a country should be covering the cost of healthcare for all those people. I think people should contribute some to their own healthcare. I do think that. There are definitely people of faith who politically are opposed to anything that could lead to a bigger government. It could cost more in taxes. I understand that the people of faith who have opposed the Health Care Act, I suppose they think that we should, as the church, meet these needs all in a private context, with money raised from the church. And I think that's a fine idea if it actually happens. The problem is that it hasn't happened to this point, where the church has personally funded enough care for the orphans and widows of our country. Maybe there's some way to make it like England or Canada where it's a given. You have healthcare, basic healthcare. It's not all about just making money. But as long as it is what it is in our country, someone has to remember the people who are left out. I personally think that it needs to be a partnership between the church and people of faith and the government, really, to help fund some of this healthcare.